I've been involved in this business from that standpoint a couple times, and each time I've walked away completely, just walked away because unfortunately there are a lot of people who are in this business for the wrong reason. You've written a law that allows people to differentiate themselves. Those who want to sling weed and sell marijuana and sell pot, go do that on your own. I want nothing to do with you. But those who are selling medicine, that's who I've been involved with. And so the people who I was involved with decided to get in the weed business, and I decided that's not for me. So I walked away.
Ian, your opponents say that you're bringing medical patients out just as a last-minute push to get people to support issue 3. Why this push now on medical? Why not have this press conference?
Of course, Jackie, you've covered the amendments from its inception. You know that's not true. We've talked about the need for medical marijuana patients to have the compassionate care that medical marijuana provides, and we've talked about it from day one. We'll continue to do so. But we've also made no bones about it that this is also a way to provide for reality. People consume marijuana today. They're adults. They're consuming marijuana right now. And no one is testing the product, no one is taxing the product, and no one is regulating the product. No one is regulating marijuana. When you don't regulate, you do not control. Drug dealers don't card kids. You've heard me say it before. It's about cash, not conscience. So we've talked about medicinal, we've talked about personal adult use. We continue to do that. We're making no bones about it because we're dealing with reality, and unfortunately across the street, they do not.
Why didn't you include compassionate for medical patients in your business plan?
Hold on a second. Any other questions from the media?
Answer my
Yeah, I
question,
have one
please.
more.
You're not the media.
Yes, I am.
This is for Mary Jane Borden, actually.
Sure.
You've been advocating for this issue for quite some time. You said you're going to be involved in this. Can you tell specifically how you're going to be involved in this after it passes?
Yes, I can. I think one thing, we're a 501c4 advocacy organization for the medical therapeutic use of cannabis in Ohio. So I think that once the commission gets formed, and also with the legislature, there's going to be a lot of opportunities for us to be a voice for the patients and to get our messages to both of those bodies so that we have a really robust regulatory environment. And that would be our next goal. That's the next stepping stone.
Have you been promised a role in this, though? Have you been promised that you will have a seat at the table when these...
I have received no promises for anything. I do this out of conscience.
What about your
From
Ohio
the
elections
accredited,
complaint? How do you complain against them sabotaging your campaign, and months later, you're now supporting them? Explain that.
That was an act of conscience because we are, again, a 501c4 advocacy organization for the sick, dying, disabled in the state of Ohio. And we had to take a look at who we are and what we stand for. I think that's important. And because every one of us, who we are and what we stand for matters. And so it matters. These people, Tara matters, Leanne matters, Kay matters. And so we can look at it, the growing model if you want to, but by and large, that comes down to safe access for the sick, dying, disabled as far as I'm concerned, and as far as the Ohio Rights Group is concerned.
Ian, what role do you see the Ohio Rights Group having in this?
I see the Ohio Rights Group, taking the action that they've had for the last 3 years and advocating vociferously for medical marijuana patients and families to continue to move not only the amendment forward, but then as we work through the legislature on enabling legislation and to provide the sort of, as Montel was talking about, that education that people need to understand why is it, what happens after this passes? How do we make sure that we affect in a very positive way the laws, the implementation of the amendment? What do we need to do to make sure that we're also dealing with the artisanal grows to ensure that they're growing the kind of craft strains for medical marijuana patients and so forth?
I should also say, let me tell you, I'm here now because now I'm publicly a part of this issue. Believe me, I'm coming back. I've gone back to the states that I've worked with and taken a look at those who try to use my name to help them get medicine in the marketplace. As vehement as I am right now about getting this amendment passed, don't let me come back here and find people slinging weed calling it medicine, because I will be the biggest nightmare you've seen. Guarantee it. I'm going to be that around the country right now. That's why I'm involved in Missouri, I'm involved in Florida. I am sick and tired. Let me tell you something. I have to travel all over this country. I'm not going to divulge any things that could, but I have to, and I made a statement. I cannot sleep unless I use a cannabinoid. I have to do what I have to do. If I get into California, and because I have a card in California, I have a card in Colorado, I go to California and if I go by a dispensary and I see sitting in a shelf, something sitting near something that I know is extracted using some sort of benzoate, something that's a chemical process, I leave the store. Most of what I consume is grown for me individually by 2 or 3 growers around the country. Like I say, I get on medication, but I get it. And that's all I try to consume. When I have to reach outside of that, I am really particular. I would venture to say in the last 6 years, I've taken samples of things that I've had to buy because I've been in a place for a couple of days and I've run out and I gotta use this. I've taken those samples then to someone to have those tested. And each time I've been so disgusted by what I put in my body. So I'm not just an advocate to help this law pass. Believe me, you asked me here, now you're stuck with me. So when she gets her medicine, if you claim you're selling medicine, and I don't care if it's an individual grower, I don't care if it's a big multi-billion-dollar corporation. If they claim that they're selling medication, it surely better be.
Thank you for being here. Thank you.
Oh, Joe. Joe. No, another lady, J-O-L-E. Only one ever.
Marshall back, Dick's Newspapers and the Vindicator again.
Okay, I'm really kind of off mic there at the end, so let me ask you, pretend I just didn't hear that. What guarantee do we have that the medicine, that this is actually going to be the kind of medicine that people need when